Okay, so again, I just want to show you quickly how to work Virtual PT Clinician. You're going to click on your class, click on your patient, enter case. Your name is going to be your last name, and your password is always 1234. Okay, then hit enter. Start. And you're going to get a brief history, and then you want to ask your interview questions. Okay, so remember, this first set of questions that come up are things that are very frequently asked to patients when they come in. So why are you here today? What are your goals? Have you seen anybody else? How bad are the symptoms? Okay, and remember, once you've asked these certain questions, then you click on click here. Right? It's going to ask you for a statement of the patient's problem, just an idea of what you think is going on. Okay? And then you have to begin your problem list, right? So we already know he has pain, right? That last thing we clicked on said he is having difficulty walking, right? Now remember, each of these need a hypothesis as well. So if I click on pain, and I think maybe he's got pain because he's arthritic. So he has arthritis. And I add that hypothesis. Okay, now why do I think he's having difficulty walking? Well, actually, he could be having difficulty walking because of pain. Right? Pain can be both a problem and a hypothesis. Right? Now, I also think he could be having difficulty walking because of arthritis. It could be that he has decreased strength, right? Now, say I wanted to add a hypothesis, and it's a hypothesis for multiple things. So I could click both pain and difficulty walking at the problem level and enter a hypothesis that I thought could potentially be true for both of these, right? So let's say decreased range of motion. Okay, now since both boxes are checked here, it's going to add this hypothesis to both of them. So you can use one hypothesis for multiple problems. Okay, then you would click done. Okay, now if you notice up here, your hypotheses are now showing up in this top box up here. You can continue in the history section without paying too much attention to this, unless you're asking a specific question. You know, if you're asking past medical history to see if he has arthritis, then you would want to highlight this. Okay, so let's do that. So I'm testing this hypothesis now, and I'm going to go to medical history, and I'm going to ask his past medical history. Okay, so now because this is highlighted up here when I asked a question, the computer is going to record that as me saying, I'm assessing his medical history because I want to see if he has arthritis. Okay, so it's more important when we get to the examination section, so I'll talk about it again there. So just to be clear here, these are the rest of the history questions, and you can click on any of these categories and find additional questions here. You know, where is he living? Is he living at home? He's living with his son, and his daughter helps a lot. Their daughter helps a lot. Okay, so after my history questions, I then go to exam, and remember that this toolbar is going to remain pretty constant throughout the program. It just gives me my problem hypothesis list again, just in case I want to update it. Do I want to add? I can delete something. I just have to, if I want to delete a problem, I would just check the box next to it and hit delete, and it would go away. Okay, I'm okay with my problem list for now. Remember, when you get to the exam, you want to switch to full body view. Okay, so this is where this now becomes important. Okay, so we want to know that you know how to evaluate this hypothesis of decreased range of motion. So you said earlier that you think you might have problems walking because of decreased range of motion. So I want to show how I'm going to assess that. So I want to click on that. And how would I assess range of motion? I would ask for range of motion, right? I would click on my goniometer and I would do range of motion of that knee. Okay? So you really have to learn to link your exam items to a hypothesis, because we want to know that you know how to assess these hypotheses, and you're not just doing exam items because you think you should. Okay? So how am I going to assess pain? Well, I know that if I go to tests and measures, here is pain. Okay, so I can assess his pain further that way. If I had decreased strength up here in my hypothesis list, then I would go to strength. Switch back to the full body view, and then I'd click on strength. So this is what we call in the program linking. You're linking your hypothesis to exam items to show us that you know why you're doing these tests and measures. Now, sometimes you have to do a test and measure just because you have to, and you're not sure it's directly related to a hypothesis, but something like past medical history, right? We're telling you, you always have to ask that. Patient's goals, you always have to ask that. Vitals, you always have to ask that, but it's not necessarily related to our hypothesis. That's when you would put it on scanning. So scanning and then vitals. Scanning means you're gathering information and it's not directly related to a hypothesis. And that's fine to do. We do that often, and that's okay. Just make sure, I'll tell you what happens all the time, is that you leave it on scanning and you never take it off. And then we can't give you that valuable feedback about, did you know why you did certain tests and measures? There is a way I can force the program to make you do this, but it is so painful for you guys that we really prefer not to do that because it will stop you at every click and remind you to take it off scanning. Quite painful for you. Okay, the next item down is diagnostic tests. So this is where, again, you're going to just review your problem and hypothesis list, either make changes or don't, but click done. It's going to give you here your common tests. So if you want to do an EKG or a rhythm strip, CBC for blood work, you could do all that stuff here. You'll also see over here further items. So if I wanted to do an x-ray of that knee, I choose x-ray. I scroll down and find knee. Oops. And I order. Okay, now you'll see here we have this capability to have questions pop up and ask you why. Why are you doing this? And you have to answer this or the program won't let you go on. So I'm doing this to rule out arthritis. And I'd hit enter. Okay, if you don't answer that, the program's going to keep you stuck in a loop until you answer it. So you have to answer that. Okay, and then it would give me the test results. It shows right knee hardware in place because remember he had a total knee replacement. Okay, you should not do a lot of diagnostic tests here, especially first couple of weeks into the program. Okay, after I do that, remember you can always click on problem hypothesis list, go back and check your list. When you're done, click done. Once I've done what I think is my full evaluation, then I want to click on management. Okay, it's going to give you your problem list here. Again, you can prioritize it and then click continue. And then they want your diagnosis. Patient may have a systemic infection. Justify your diagnosis. Remember, this is what in your history in your exam led you to this. So we know his knee was red, hot, and swollen, and he had a fever. Okay, then you choose your confidence level, enter your diagnosis. Okay, so again, this top box is going to be what you entered for problems, and this is what we wanted you to come up with. So at this point, you're comparing what you found to what we wanted you to come up with. Click continue. You decide to treat the patient, treat and refer, or refer prior to treatment. This is your prognosis section. So here's where we want to know is what kind of progress do you think he's going to make? Is therapy going to help him? Is it not going to help him? Is it going to help him to a certain degree? And you choose your levels here. Okay, and then remember goals. You have to write goals for everything. So click on a goal and write a goal. I'm going to put gibberish in here. And I have to click save after each of these, right? So click save. Now, you can highlight multiple goals. Oops. Sorry. Nope, you can't. Okay, so choose another goal, but then I can go and link the goal that I wrote for this first problem to this second problem as well. Link this to, I'm going to say, decreased appetite. Oops. So I'd have to go back to the one where I actually wrote a goal for. So I wrote a goal for pain, and I'm going to say link that goal to decreased appetite as well. I still have to click save. Okay, so I have to click save. So now I'm highlighted pain. It shows I have a goal. I go decreased appetite. That same goal is there. Improved functional mobility. There's no goal. I need to write one. And I need to save it. Remember, so even if I want to link this fever goal to confusion, I still have to hit save. Okay. Scroll down to make sure you have all of them that are there. Click save, and then click continue. If I didn't have a goal there, the program would tell me. Okay, in this top box now, whereas when you're doing your examination, your hypotheses are here, now the problems are here. So now you have to choose one of these and decide how you're going to treat it. Okay, so for his pain, I am going to do physical agents. I'm going to select, and I'm going to do cryotherapy. I'm going to do cold pack. And I choose select, and it shows up down here. Okay, so each of these intervention categories here, not that you have them yet, but you can probably find it online, are the same categories that are in your guide to PT, your guide for physical therapy. Until you have that, you might want to think about writing some of these down. So under therapeutic exercise is all of your primary areas: strength, range, power, those kinds of things. But again, most of these are going to have breakdown menus. So again, now I can choose active assistive, active resistive, or task-specific training. Under manual therapy, there are going to be sub-menus again: mobilization, manipulation, soft tissue, or spinal and peripheral. Okay, so many of these intervention categories are going to break down into smaller things. You're not going to find specific exercises here. So you're not going to find straight leg raises, because that is an active exercise, and it's going to be under therapeutic exercise, active assistive or active resistive exercises if you're adding weight. So you're not going to find bridging here. It's an active exercise. So you need to know the categories of activities you want to prescribe and not a specific exercise. So that tends to be a hard part in the program until you understand what is in these categories. Most of what you're going to work with this semester is going to be under therapeutic exercise. Okay? Aerobic capacity training, aquatic programs, balance, flexibility. So if you want to do a range of motion, if he has a contraction or range of motion, you're going to look under flexibility. You want to work on gait, you're going to look under gait and locomotion. So most of your big interventions are here. And then functional training is going to be ADL and IADL. Back school, this is if you're retraining someone on proper lifting, you know, how to lift. They have an ergonomic job and you have to do proper lifting. Barrier accommodations are going to be if you are teaching them how to go up a ramp or through a doorway. Device and equipment use, you're training them on a prosthesis or you're training them on a walker. Simulated environment, you're simulating a task. You know, they have a task at their job that they have to do and you simulate it in clinic. Task adaptation, this is one we use a lot. This is if you actually want to show the patient how to change a task so that they can do it within their limitations. Manual therapy, think of these mainly as things that you're going to do with your hands. Prescription application of equipment, this is where you're going to do walkers, braces, canes, crutches, all that stuff would be prescribed here. Airway clearance, not going to use a whole lot, but this is someone who you're going to do breathing and manual mechanic techniques and positioning, your chest PT stuff. Integumentary skin stuff, electrotherapeutic modalities, this is where you'll find TENS, all your electrical stimulation things, this will break down, and we ask you what type of stimulation you want to use. Physical agents are going to be your sound, ultrasound, heat, cold therapies. Mechanical modalities is mostly traction. And alternative medicine, this is where you can prescribe acupuncture, Reiki, or yoga. Okay, then under collaboration, this is who you want to refer to. If you want someone else to take a look, you want a speech therapist, social worker. Education, diet, disease, exercise, you can, smoking cessation, those kinds of things you can do here. And then there's counseling as well that you can order here. Once you have done all of your interventions and you're done with the case, you would click evaluate. Notice here there is a SOAP note, so you could write, we could ask you to write a SOAP note. We're not going to do that yet, so don't worry about this section yet. Notes, this is where you would find anything that you had copied and pasted into the notes as you were doing them. Okay, and don't worry about learning now either. So when you're finished, you would click on evaluate. It's going to ask you a few follow-up questions. Have you seen a patient like this before? Yes, yes, very confident. And then click on review results, and this is where it's going to tell you how you did. Your diagnosis, our diagnosis. Systemic infection and sepsis, very much the same thing. You would do very well for that. And then don't forget to click on these categories up here because they'll give you more information, right? Your problem hypothesis list and what we wanted you to come up with. The examination items that we wanted you to do and that you did do are going to have a star by them. The ones we wanted you to do and you did not do will not have a star here. Items that you did and we didn't want you to will not show up here. Okay, so if you think you did something and it doesn't show up here, that doesn't mean you didn't do it. It means we didn't care if you did it, so it's not here. Prognosis is going to match it to what you did. And your interventions, again, is going to tell you what, how your interventions compare to what we wanted you to do. Okay, so an overview of clinician. Hopefully this will help, and you can always go back to it and review certain sections if you need to. Okay, thank you.